Hello, everyone. Dr. Merkel here. Dr. Van Merkel. It's January 26th, Tuesday, and just thought I'd give you a little update on what's happening in my life and our practice. First time ever in my almost 40 years of practice, 38 years of practice, our clinic is shut down now because of COVID. And last year we closed the doors, but it was still open for business. We were able to take vitamins out to patients, take out rec forms, take basic things, and have at least the staff, my team working in the office. I have 4 full-time staff, 2 associate doctors, myself, and we always kept things open. But this year, right now, things are more challenging. We have, of those 4 ladies, we have one is on maternity. She just had a baby, which we're very happy for, and she's doing very well. We have one lady got COVID a few weeks ago, and so she was out for that for a while. Then she turned around and got pneumonia, and so she's out. Our third lady on Thursday or Friday last week, she got tested, found that she had COVID. Well, she'd been working in our office all along. She's our main front desk lady. And so we've had to close down until we get the test results from our other staff person, or other staff lady, as well as the 2 doctors and myself to make sure everything is good. And so this is an unusual situation. We do have some of the staff doing things at home, and this is where the benefit, the beauty of telenutrition, science-based nutrition is so very nice to have. We have our doctors are able to take care of patients long distance. We're able to do long distance phone consults and still take care of patients today. And so they're doing consults, they're doing reported findings, we're reaching out to our current patients with emails, phone calls, social media. And there are so many things we can do. Even though we don't have our office open, we are still active in practice. We're still actively taking care of our patients. It's just not face to face. And so what a blessing this time of our time of when we have telenutrition and all the things to make what we do in nutrition easy. In fact, you may not know, maybe you do know, that about 90% of our practice is nutrition. And so all that translates very easily into telenutrition. And I sometimes listen to my associate doctors when they do the radio show, and they routinely talk about cases of patients they see many states away that they take care of, that they do telenutrition. They get referrals from from patients that have friends or family in other states. So that is one thing that really helps our practice go, is our telenutrition. So I don't know what's happening in your state. In Ohio, we're supposed to be distancing ourselves. We're supposed to limit activity and always wear a mask, which is okay. But our office has been doing everything as far as guidelines, masking, cleaning, etc. for a year, it seems like, or more. But we always did those things. We just tightened them up according to current guidelines. But the thing is, you might be a little bit troubled, depressed, or whatever because of the situation, but let this be a time where you can go and reach out to those patients that you haven't seen in your office for a while, or maybe even the ones you have. There's nothing your patients would love better. Okay, maybe there is, but hearing from their doctor, somebody that's worried about them. Right now, they're maybe locked in their house. They're limited on what they can do, and what they need is someone who can give them some help. So reach out to them, let them know that they're worried about COVID, or even if they get it, that there's things that you can do. You can order lab work, and they can go to the lab and get it done safely. And you can analyze the reports, and you can send an SBN report all electronically online, like you all know, and take care of your patients easily and safely. And like I said, our practice last year in 2020 did a little bit better than the year before, even in the year of COVID. This year, I don't know how things are going to go. I'm hoping they'll go well, but we are going to work. If we do, I'm expecting we'll be as good or better than the year before, than 2020. But the thing is, we're not just sitting around hoping things will get better. We are going to make things better. We're going to contact our patients. We're going to actively work with them, try and help them get well. We've had many of our patients have COVID, and no one has gotten sick. No one has died from it under our care. That's true. No one has died from COVID under our care. And when they get sick, we give them a vitamin protocol, which you're aware of. It's got the vitamin D, the zinc, which we've all read about. And you ought to be testing your patients for vitamin D levels, because they might be taking vitamin D, but they're not taking enough, or what they're doing isn't working. So you ought to be testing for vitamin D, maybe even zinc. Test for zinc levels. That's good. Test the hair for that. Although you can actually do blood tests too for that. So vitamin D, zinc, vitamin C, obviously, oregano oil, all that you can get from SBN. There's that special product, SBN-CC, curcumin complex, curcumin, which is turmeric, bioflavonoids, vitamin C, and ginger are all antiviral, antibacterial, and they'd be a great thing for people to take now. I mean, I take all those every day to try and keep myself healthy and strong, as what your patient should be doing the same thing. In fact, I got on the radio last year and told them, winter's coming. Don't be surprised if COVID gets worse. Yeah, I was telling people, when this thing started back in April and May, that it'll probably get better during the summer, but then expect it to get worse in winter, which exactly is what's happening. And so we started telling people, stock up, carry a lot of vitamins, because your patient's going to need them. You get out on social media, you got to do some radio commercials and let them know that you got a protocol that can help boost their immune system and help their body fight COVID. And so you got to get out there and do it. Let them know. But this is a time where our doctors, we're not seeing patients in-house, so they're not doing your acupuncture, their chiropractic, those kind of things. And so now is the time to contact the patients, give them a call, send them an email, send them a letter, and let them know you're thinking about them, that you can help them with whatever health problems they have, and that you can help them survive this. So look at this as an opportunity to help your practice grow, and contact those patients that you haven't seen or heard of in a long time. I mean, you're probably like me. You've seen patients for many years, and a patient will come to your mind. Well, now's the time to give them a call, a special note, say, hey, I was thinking about you. Just wondering how you're doing. I know we treated you for whatever you treat them for. You had chronic fatigue a couple years ago. Just hope you're doing well. Or maybe you had MS and you're doing well. Which reminds me, let me tell you a quick story. I was out running on a trail around here close by. And it's a very common public trail. And a lot of people are walking their dogs and running, whatever. And I was running up a hill, and I passed a couple. And we both stopped once we were past, and I turned around. And now this lady, I treated probably 25 years ago, maybe even more, for MS. She was in her early 20s, maybe only 19, 20 at the time. And her MS was progressing very quickly. And to the point that she could no longer run, is affecting her hands, numbness in her hands and feet. She had balance problems, vision problems, and she had positive findings on the MRI PET scan for MS. And so we took care of her, and we did all the testing. And if you got MS cases like this, you got to do a complete blood test, the hair test, and you have to do the UTEC, because every one of these patients have toxic heavy metal problem. And so we identified that, we got her on a program, and all of her symptoms went away within, I don't remember, 3 to 4 months, completely gone. She's back to running 3 miles a day. Well, after about 4 or 5 months, she asked me, do you think it'd be okay if she gets pregnant? Because she'd been told by her doctors treating her MS never to get pregnant, because her MS will get worse. Well, she was married, she had a husband, she wanted to have kids. And I said, well, just keep doing what you're doing. Just keep doing what you're doing. If what you did got you healthy, and you have no symptoms, and you're even running and doing everything perfectly like a regular person, of course you can have kids. And so she had 2 kids, no problem. After the second child, she had them like back to back. She had a baby, nursed, had a baby, and nursed. At the end of the second baby, while she was nursed, she got some numbness. And I said, don't worry about it. You're just nutrient depleted. Once you're done nursing, give your body some time, get built back up with your nutrients, do what you need to do, get tested, make sure we're not missing anything. And she recovered, and that's been many years ago. Now she lives a fair distance away. I sometimes drive a half an hour to take a walk during some parks and things. And so there's a chiropractor that she sees for adjusting closer to her, but I haven't seen her in many years because I showed her what she needed to do to be healthy to take care of this MS problem. So I prefer that she get tested every year, but we gave her the vision, the plan that she needed for her body to be healthy. Actually, it really amazed me. I remembered her name, her and her husband, but I did. So anyway, I hope that gives you some encouragement. People are out there looking for help. You reach out to them. You let them know that you can help them, that you can get blood testing done, even urine testing. Have them drop off the urine at your office. Or here's even better, have LabCorp do the urine testing. If you're not doing it in-house and you're sending the patient to the lab, just have the lab do the dipstick urine. Very easy to do. We commonly do that, and a lot of other doctors do too. So get busy, don't stop. Now, if you may have noticed that if you have been doing a lot of reports, that your reports have been slowed up a little bit lately. Well, SBN is not standing still on this either. We have done some major modifications and revamped the report to make it more concise, more directed to your patient for what your patient has. To take into consideration all the meds they're on and how they're integrated in things, take into consideration other factors and other things that really make a difference in the report and how you treat your patients. I mean, simple things you may already notice, like gallbladder. They had a gallbladder removed. Maybe they've had their thyroid removed, or they're all, you already know the insulin, but all those things, they had their gallbladder removed, their thyroid removed. That changes the report and how you're going to take care of that patient. And so there's other things we've been doing too with SBN, but we are working right now to make that report as concise, as specific, as directed to your patients, but like no one else in the world has a report as thorough, comprehensive, complete, ready to go for the patient, backed up by years and years and thousands of patients. And if you got a great case, send it to me. And I always love reading how other doctors getting great results like we do. And I know many of you have sent me your cases, and I've actually seen a lot of them when you send me a ticket. So yeah, we're checking things out, and I'm very excited to see what you're doing. Let me know how you're doing, and keep your chin up. Contact your patients, and I'm going to be out lecturing again in April. In April, I'll be lecturing again. We've got lectures planned in Florida. They're the most open state. So I know we're having one in Orlando, I think one in Jacksonville, and then one on the Panhandle on the west side of Florida. So we're looking forward to seeing you, get a little updated on training. We got some new material for this lecture. I'm sure you're going to enjoy, but take care of yourself. You take your vitamins, you get tested, and then you can be a better service to other people too. So take care. I'm going to be doing some more training videos here coming up on some new labs we're doing. But you have a great day. Keep your chin up. And I'm Dr. Merkel. We'll chat with you later. Bye.